Right now I'm at the Kirtipur Cleft and Burn Hospital, the largest such hospital in all of Nepal. We were last here 3 years ago, just before COVID. You cannot imagine how pleased we were to return this year and see that many of the treatment paradigms, many of the forms that we'd introduced were being used and being used successfully.
And these mission trips primarily serve underprivileged patients in developing countries who would not otherwise receive certain surgical or medical care.
The teaching done by the missions is very important because that's one of the source of our learning. It is for all of us, which is really, really important for the growth of this department.
What we're continuing to see here in Nepal, unfortunately, are very severe burns. And right now, about 30% of their patients who come to the hospital die from their advanced burns.
It's almost impossible for these patients to take enough calories by mouth to achieve their nutritional goals. So the patients become malnourished, they have poor wound healing, they lose weight, they lose muscle, they become infected, and this just creates a vicious cycle. Our big project this year has been helping people understand the importance of nutrition. We're actually reframing it with the leadership at this hospital where food is not just food, right? We're saying food is medicine.
Anesthesiologists are teaching us, the many different aspects of the burn care in the ICU.
You and I need 6 liters a minute when we're standing here relatively healthy, right? But these patients, she needs about 12 liters a minute.
We've also been doing some very advanced hand reconstructions because there's so many individuals who work in situations where they don't have the kind of labor codes and regulations we have.
How can we take what they have and keep advancing hand surgery in Nepal? Just looking at the difference between our first trip and now, I know that each successive year that we come and work with these surgeons, the care will improve dramatically.
There's a patient that we saw earlier in the week who came to see us who had a brain tumor that was excised successfully, and she had recovered and healed well from that, but had lost the facial nerve function on one side of her face, which gave her quite an asymmetry and an inability to talk well and an inability to smile and show her emotions in a normal way. Smile. So we were able to perform a surgery, a very complex surgery that we do back in the United States frequently, where we take a muscle from the leg and we can transplant it up to the face along with new nerves and hook everything up underneath a microscope and restore both the nerve and the muscle function to this patient's face, which then allows her to have normal symmetry, a normal appearance, and allows her to smile and show her emotions once again.